Hello, welcome to CRPS Contender, my complex regional pain syndrome education channel. This is the first real video since my hiatus has ended, and it is going to be on cold. Cold is coming, winter is right around the corner, so I want to talk about how CRPS interacts with freezing temperatures. First, let's talk about what happens in a healthy, normal response. This is known as the hunting reaction or the hunting response. It is also called cold-induced vasodilation. Now, in very short terms, basically this means that the body goes through cycles of having the distal, the far away from your core, blood vessels get tighter and then loosen. This allows the core temperature to remain high without causing those further fingers and toes to die from lack of oxygen. So, to get a little more in-depth in that, the initial response to exposure to severe cold is a strong skin-level tightening of the blood vessels. This is a vital first defense against losing excessive amounts of body heat to preserve your core temperature and allow you to survive in cold temperatures. However, this does impair our tactile sensitivity, dexterity, fine and gross motor functions, and muscle contraction. It also causes an increase in pain and sympathetic drive. This is not sustainable in the long term, so to avoid ischemia and necrosis from lack of oxygen, the body cycles to loosen the blood vessels and allow blood to resume its flow. How does that happen? When exposed to the cold, there's an increased affinity of alpha adrenoceptors to norepinephrine, which is a sympathetic neurotransmitter. These receptors cause vasoconstriction in response to the circulating norepinephrine. This causes a cessation of blood flow to the downstream areas. This causes tissue temperature to fall and causes an interruption in the conduction of sympathetic nerve impulses. This also means that the norepinephrine flow ceases. Due to the lack of norepinephrine binding to the alpha adrenoceptors, vasodilation occurs, allowing the tissues to rewarm, avoiding ischemia and necrosis, and nerve conduction to resume, allowing nerve impulses to make it back to the brain again. Then the constriction dilation cycle restarts, allowing to maintain a homeostasis and preserving body heat without causing necrosis, causing ischemia. This cycle happens in the cutaneous arteries while the veins remain constricted at a low temperature. Now that is what happens in a healthy system. That is not what occurs in CRPS. So let's talk about that next. CRPS causes ischemia reperfusion injuries. I've talked about that extensively in my videos of microvessel malfunction and congested capillaries. Those are both based on a paper by Coder, but in short, what ischemia reperfusion injuries are cycles of oxygen starvation and then corrosion due to oxidative stress. Persistent CRPS, which is also called cold CRPS, is ischemia dominant, which means it has lots of vasoconstriction as the primary resting state for that individual. This can often get misdiagnosed as or be comorbid with Raynaud's disease or Raynaud's phenomenon. CRPS causes an increase in the skin-level adrenoceptors in both the affected and contralateral unaffected side. So if you have CRPS in your right foot, this means you have an increase in the adrenoceptors at skin level on both the right foot and the left foot. In the acute stage, which is the first several months of CRPS, norepinephrine in the affected limb is actually decreased. However, the overall systemic catecholamine expression is increased. This kind of reverses in the chronic stage. Reversing isn't quite the right term, but the norepinephrine normalizes, goes back to a more regular sort of expression circulation within the system. However, because of the upregulation of the adrenoceptors, this means they are sensitized to that lower amount of norepinephrine. And so they react excessively to the more normalized norepinephrine levels, causing excessive vasoconstriction. Chronic CRPS also has autoantibodies against alpha-1A adrenoceptors and beta-2 adrenoceptors. These two styles of adrenoceptors control vasoconstriction as well as broncho and vasodilation. Because the body eats these receptors, this also creates a supersensitivity. So you have the upregulation at the skin level, with the body eating them as well and creating a supersensitivity. So it creates a mess, basically. But it causes an excessive reaction to the neurotransmitter norepinephrine. So this cold-induced vasoconstriction in chronic CRPS is excessive and not properly balanced with cold-induced vasodilation. This leads to prolonged cessation of blood flow and ischemia. In freezing temperatures, the myelin sheathing also congeals. Myelin sheathing is a fatty substance that wraps around nerves to make the signals sent along those nerves go very fast. This impairs myelinated and unmyelinated nerves as well, because once you remove water from nerves, they are made of 60% fat. The cold impairs nerve function as well as blood flow, and this can cause CRPS to spread. So what does this look like in a practical application? Areas feeling numb, pins and needles, or staticky as the nerve conduction ceases, which means you are not getting impulses to the brain from those areas anymore. The skin and nails can look blue, purple, gray, or very pale white because the blood is not circulating there, which means either deoxygenated blood is sitting in that area or there is just no blood in that area at all. This reduces motor control and proprioception. Proprioception is very important. It is the proprioceptive signaling that tells the brain where to send blood. So if you have a lack of proprioceptive signaling, this causes further problems because blood is not being sent to that area deliberately. Inactivity also reduces proprioceptive signaling. This means even though you are very cold and you don't want to move, you need to keep moving. Do not hibernate until spring. Keep that circulation going so that you are not causing ischemic damage to your distal areas of your body. This is not really related to freezing temperature, but lots of people want to use ice on CRPS. Do not do that. If you do need some sort of cooling temperature, use something that is greater than 50 degrees, because once you hit below that, that starts impacting the nerve conduction. And unfortunately, it is the myelinated nerves that stop conducting first because they have that fatty myelin sheathing. And those are the ones that are functioning more appropriately in CRPS. So if you're having the nerves that are working better stop sending signals, and the unmyelinated small C fibers, which are the ones that cause the burning pain, still keep sending signals, you're just further hampering yourself. So ice should not be used on CRPS. Now, what are some practical things you can do in your daily life? Keep warm. Use appropriate socks, boots, gloves, coats, hats, scarves. Heated vests are great. They can help keep your core temperature warm if you do need to go out walking. Hot packs are wonderful. When you get home, heating pads, heated blankets are great. Hot food and hot drinks and warm baths to help increase your body temperature. Keep active. Increase that proprioceptive signaling to allow blood to keep going even while you're cold. Limit your exposure to freezing temperatures. If you do have to go outside, try and keep it short. Make sure you're appropriately protected. Walk carefully. If you're in an area where it snows or it gets icy, the ground can be slick. The lack of proprioception and balance, the lack of fine and gross motor control can all contribute to slips or falls, which you don't want to do if you have CRPS because that can cause another soft tissue injury, which may cause the CRPS to spread. If you use cannabis as part of your treatment, do know that cannabis is a peripheral vasodilator, so that might help you if you come back and want to get high. That may assist in increasing your blood vessels peripherally. If you would like to see where I got the information for this video, I have the source sheet next. I'm going to leave that up for a second or two, but feel free to freeze this screen if you want to look at it more. I'm also going to put them all in the description below if you'd like to take a closer look at them. Alright, thanks so much for listening. If you liked what I do here, please like. That's really the only way the algorithm knows to boost this content. Subscribe if you want to make sure you catch further updates that I'm going to do. I'm going to be trying to put out at least 2 a month. I'm going to be focusing on going over academic papers about CRPS and breaking them down, making them. I'm going to try and keep the videos less than 12 minutes. Hopefully I'll make it with this one. Thanks so much to my patrons who have kept with me throughout this hiatus, Chase and Emily Malcontent. I really appreciate your support. If you'd like to contribute, my Patreon is CRPS Contender. See you next time.